Haven't met, but I'm going to introduce to you is Auntie Maxine Risk. She is a woman of Aboriginal descent, so if you'd like to make your way up so they know who I'm talking about. A proud Ngarrindjeri woman from South Australia, Maxine became a community ambassador for the study when they heard of her exceptional way that she beat diabetes, and you're going to hear about that. I won't give away too much because it is absolutely amazing. She's well respected in the Aboriginal community, and she's continually being asked by the community for her advice about how she turned type 2 diabetes around. So we're very privileged to hear from you today. And also Uncle Harold Stewart. He's currently working, you make your way up soon, currently working with SA Health in Medical Research Institute as a senior cultural advisor, working with the Heart and Stroke team and the Type 2 Diabetes Study team. Harold is a senior Indigenous Koori man. He's an elder of the Eora and Yuin First Nations, originally from the La Perouse, I had that wrong, I hope not, community in New South Wales. Harold had lived in South Australia for nearly 40 years and has a long career, 26 years in the Australian government. He worked in the Department of Health and Ageing, mainly in Aboriginal health, state government for 5 years as a senior policy officer, and in the revival of language as a manager of the Yatia Ware Wadley, is that right? Yes, Wadley Language Centre, and has also worked for Aboriginal Health Council of South Australia and Cancer Council of South Australia. He's a well-respected elder who is well known in the national arena of Aboriginal affairs and is highly regarded in the Aboriginal community in South Australia. He's also my family, so I'm pleased to be here. I'll probably need that, won't I? So we're going to have a bit of a chat. I'll be just hiding here, but you already know what I look like. Okay, so we're going to start with you, Professor. Now, you've been studying diabetes for 30 years, and you were one of the first people who actually predicted the huge increase in worldwide diabetes. What are the changes in the past 30 years, and is diabetes going to affect more people in the future?
Shelley, thanks very much for that. Yes, I did a study in 1975, it's a long time ago, in Nauru, which is now very public because of the asylum seeker problem, and found that 1/3 of the adults in Nauru had diabetes. And that was at a time when maybe only about 2% had it here in South Australia, and predicted with the changes, we use the term Coca-Colonisation, the change of lifestyle, people having a lot more fast foods and less activity, etc., that diabetes rates would rocket. But people have this very conventional view that type 2 diabetes is associated with poor diet and lack of exercise, and I'm sure Alex and the others may talk about it later, that we now know maternal and child health is so important, and that things that happen during pregnancy or even before pregnancy can affect how the baby's genes react in adult life to get diabetes. And this is an understanding that's just developed. But at the moment, the epidemic is continuing to go up and up and up, and yesterday the International Diabetes Federation announced there are now 411 million people in the world with diabetes, and there'll be over 600 million in 2040, and I think it's probably the biggest epidemic in human history.
Just that comment alone there about the baby, that just on a personal note, I had to stop drinking Coke. Don't mind the odd Coca-Cola, so I had to stop drinking Coke because I did IVF because of the caffeine, which I am now very grateful for. Okay. Now, Alex, why do you think that in the Aboriginal communities, why is it so bad?
Well, we really don't know all of the answers to that question. I think the easy answer is, well, diet has changed, lifestyle has changed, and I think those things really do play a part. I think in many Aboriginal communities we carry too much weight. I'm almost a poster boy for that in many respects. But I think there's a whole range of other factors at play. There is the stress and worry we carry in our lives. There is the way in which mainstream life and policy over the last 100 or 200 years has affected the way in which our communities operate and the way in which we can care for each other in the ways that we've always wanted to. So change has really writ large on our communities, and I think this change has significant consequences. Some of them play out in the context of diabetes. I think one of the other challenges is we have the triple whammy in places in Aboriginal communities of poverty, of poor access to healthy food, and high cost of purchasing that sort of food. So there's many things running against us, and I think we need to understand what drives this story, not just so that we know, but so that we know what, in God's name, we're going to do about it.
Yeah. And not only that, in the Aboriginal communities, only is the cost expensive, it's also the food is not fresh, and it will often be old and off. So that's quite devastating. Now, some people, Professor, are even telling us that Aboriginal people are bound to get diabetes. Is this true?
That's a tough one. I don't think it's inevitable. One of the important things about this study, as Alex mentioned, is actually understanding there's so many stories. Is it overweight? Is it lack of exercise? Is it maternal and child health? Is it poverty? Is it the oppression and racial, anti-racial behaviour on other people's parts? So that it's hard to tease out whether it's inevitable and whether, if many of these pressures were relieved, that the diabetes wouldn't be happening. There used to be a theory that Indigenous people had a genetic tendency to diabetes, and that sort of suggested weak genes, which is sort of insulting. So I don't think we actually know the answer to your question. I would hope that it is not inevitable, and that with a better understanding from this study, which is absolutely unique, that we may be able to develop the interventions that will ensure that it isn't inevitable.
So what can we do to reduce or prevent diabetes in Aboriginal communities?
Well, the new National Diabetes Strategy has already, and it was one recommendation that they actually dropped out that Alex and I put in, that there should be a national prevention program for Indigenous people. But unless we understand better what the causes are, but at the moment I think much more attention to maternal and child health. I don't know if Alex would agree. I think if I had to pick something now that can change the picture now, as it will look in, as it will look in 30 years' time, that much more attention to healthy pregnancy, healthy pre-pregnancy and post-pregnancy care of children and the early years of life. And there's my son's actually working on fetal alcohol syndrome in Sydney. And, this is another complicating feature that, has to be taken into the equation in terms of the look at the maternal and child situation for Indigenous health.